So welcome everybody. Thank you so much for joining us. This is our second HWISE Now virtual coffee hour, and we're really pleased that you've been able to take the time to visit with us today. We've again had great response to our invitation, and we've got a diverse group of people. I know some, but it's new faces and new names. So thank you so much and welcome to everybody. So for those who haven't been involved in HWISE, I just want to introduce myself. I'm Wendy Jepson. I'm a geographer and university professor at Texas A&M University. I have several roles, one as Associate Director for the Texas Water Resources Institute, and then I also lead the HWISE, the Household Water Insecurity Experiences Research Coordination Network, a collaboration that's been ongoing for many, many years, and with the financial support of NSF. So we've really built this vibrant community of practice that fosters sort of these key analytics and theoretical advances to examine and understand the causes and outcomes of water insecurity at the household scale. My own research examines dimensions of unjust and inequities in water systems and institutions, and of course, really driven by ethic of water justice and thinking about the political economy around water systems. Before we move into the topic of today, I also want to acknowledge the many contributions of researchers in this collaboration, and some of which we'll mention today and who are joining us in this coffee hour. And again, want to recognize the support of the National Science Foundation. So for members of the audience who would like to learn more about HWISE, you can visit us at hwise-rcn.org, and you'll have a whole bunch of information on that website, so you can learn about what we're all doing and what kinds of things and questions we're interested in exploring as a collaboration. So we are going to be recording and already recording this event, and we're going to host it on our website or HWISE YouTube channel. So we're in a regular Zoom room, and so if you don't mind, if you're not on the panel, if you would mind turning off your video and your audio, that would be, I think, helpful in focusing our conversation. And then, of course, when we move to the Q&A, feel free to turn both of those on, as we want to have a free-flowing dialogue and organic discussion. So as I mentioned, our format is designed to be an informal discussion. So if you have questions, please add those in the chat. And then after several kind of rounds of discussion, we're going to go to a Q&A, and I'll be pulling those in as well, so we can move forward those conversations. So my goal is to keep it conversational, and at the hour, we're going to turn off the recording. However, based on feedback from our first HWISE Now event, there were many people who wanted to stay on and continue talking. So we're gonna, for those of the panelists who can't stay, they will stay. Not everyone will, but we hope to have that continue over. So feel free to add those questions at that time. So now to introduce our fabulous discussants. Would each one of you please tell us a bit about yourself, where you work, and this brief introduction and overview of water insecurity in schools and healthcare facilities. So we'll go with Godfred first.
Okay, so thank you for the invitation to discuss this important topic on water insecurity in schools and healthcare facilities. As you rightly heard, my name is Godfred Boateng. I'm an assistant professor and the director of the Global and Environmental Health Lab at the University of Texas at Arlington, which is part of the UT system. My research seeks to understand the multidimensional factors and processes that shape health and health equity across spatial scales. That's household, community, institutions, and at the national level. I do this under 3 themes or streams. So the first focuses on resource insecurity and health assessments in low and middle income countries. I'm currently focusing on energy insecurity and health assessments in Colombia. Secondly, I focus on the development and measurement of health indicators. Thirdly, I explore the socio-ecological determinants of cardiometabolic diseases among vulnerable populations. So previously, I worked with Dr. Sarah Young most of you might know her as her postdoctoral research fellow. And if you have used the HWISE scale, then you've seen the most important outcome of my work with her and the HWISE team. So for this discussion, I would like to focus on access and use of water in schools and healthcare facilities in developing countries. Thanks for having me.
Thank you, Godfred. Ellis.
Right, Wendy, thanks for putting this together. It's a real pleasure to be part of this amazing group talking about water insecurity in schools and healthcare facilities. So I'm Ellis Adams. I'm at the University of Notre Dame in the Q School of Global Affairs, where I'm an assistant professor of geography and environmental policy. I'm trained as a human geographer, but also with a background in natural resources and environmental policy. So in my work, I bring these sorts of perspectives together. And my research follows about 3 or 4 streams. One, I seek to understand access to water at the household level, particularly in cities and informal settlements in different countries. Within that stream, I also focus on environmental risk. So what are sort of pathways through which water gets contaminated? What is the household decision-making dynamic or the dynamics that influence contamination? And so part of that connects also to work around flooding, for example, any sort of exposure pathways that contaminate water. I also look at water policy and governance at different scales. So a lot of my work really looking at whether access is sort of organized around public water delivery, private, or in between, but also community-based institutional mobilization around access to water, broadly capturing all of that under governance. And then gender is a big part of what I do. And within the gender stream, I'm not only trying to understand how access affects women, but also how women, as a result of that, either are willing or unwilling to participate in water governance, as well as what sorts of institutional structures eliminate women or women's voices in water governance. And theoretically, I engage with environmental justice, but also political ecology, feminist political ecology, to sort of solidify my work. In sort of water in healthcare facilities and schools, it's an area I'm new to, but really getting interested in. So in terms of my experience, I'm working with the World Bank now to develop what they call WASH and Health Index for Africa. And part of the metrics we are using are WASH in schools and healthcare facilities at the country level. And of course, that's where I realized there's so many data gaps. So it's a really pertinent discussion to have now. I'm also finally just working on maternal health, child health as they relate to WASH in healthcare facilities in Northern Ghana. And I'm doing that work with my wife right now. We just got IRB clearance to look at pregnancy and sort of water insecurity experiences at sort of different health centers.
Thank you so much, Ellis. Cassie, would you introduce yourself?
Sure. Hi, my name is Kessie Workman, and I'm an assistant professor in anthropology at the University of North Carolina at Greensboro. I have a few ongoing projects. Primarily, I work in Tanzania and have a project that's looking at multiple resource insecurity, so water insecurity, wash insecurity, food insecurity, and looking at the health outcomes associated with that. It's a collaborative project. So my co-PI is an engineer at North Carolina State. So in addition to looking at subjective measures and the lived experience, we're also doing water and soil testing and microbial source tracking. So we're also looking outside of the household, you know, and I think that that relates to this panel, looking at, you know, what are some of the exposure pathways that individuals have, you know, from multiple water sources or in places like schools or in the street, as the case may be. In addition to that project, I have a project in Ghana, which I was brought on to. It's led by engineers. They developed a pit emptying technology. And so I was brought in as a social scientist to look at gendered decision-making at the household level regarding sanitation, like fecal sludge management. And so that was a new project. I only got to travel one time before everything went down. I was actually on my way back from Ghana when I started seeing all the news about lockdowns happening. And so that's one project, again, that's also interdisciplinary. And in terms of my domestic research, I have some preliminary work here in North Carolina looking at the effects of floods here, and also, again, with collaborating with engineers at state, trying to look at, what are some community sensitive technologies that might better suit some of the small communities here in North Carolina, and looking at what the meaning of connection is for people here to infrastructure. So for purposes of this panel, I think I can speak to, similar to what Ellis said, is looking at, what's the totality of exposure pathways. I think that is something that I'm really interested in looking more at. And I think, also looking at what the gender dimensions of WASH infrastructure are. So not just, in terms of decision making, which is something I'm working on, but also stigma and blame. And so you see that particularly around, menstrual hygiene, which is obviously really important for people who menstruate when they're at school. So that's.
Thank you, Cassie. Greg and then Christina.
Oh, thanks again, Wendy, and thanks to everyone for joining. My name is Greg Pierce. I'm the Associate Director at the Luskin Center for Innovation and a faculty member in urban planning, both within the UCLA School of Public Affairs. My research is really motivated by household access to what I'll call essential environmental services, most fundamentally water, and really looking at all aspects of the human right to water at the household level. That being said, a lot of my research scale-wise is focused at the metropolitan level, at the utility level, the political economy of service provision, why services are provided to some areas and some populations as opposed to others, and also increasingly focused at the subnational level and larger policy frameworks and funding that can motivate and redress existing inequalities at the household level. Most of my work now is focused in California and increasingly across the US, but I had a decade of work internationally in urban areas in low and middle income countries. So I sort of bring both perspectives, hopefully, as it comes to WASH. And then my interest in WASH or water insecurity in schools and healthcare facilities is motivated sort of both generally in the sense that when we look at where there are inequalities in the human right to water, a lot of schools and also daycare facilities pop up when you're just looking at sort of broad assessments of where there are gaps in water access, but also specifically in a focus on water trust and on plumbing issues and how those contribute to inequalities. And with schools, daycares, and healthcare facilities being large sort of underfunded public buildings, there's a lot of issues that crop up, particularly around lead, and there are efforts policy-wise to redress those, at least nominally, but a lot of gaps in implementation, in funding, and in getting beyond access to use, and sort of, truly addressing individual level insecurity. But with that, I think I'll pass it over to Christina, or back to Wendy.
Oh, actually to Christina.
Good morning, everybody. It's a pleasure to be here drinking coffee with you all. I'm Christina Hecht, and I work at the University of California Nutrition Policy Institute, which is in the statewide arm of our land grant school, so our Division of Agriculture and Natural Resources. I'm the senior policy advisor, and I have something in common with Ellis because my spouse also works at Nutrition Policy Institute. So I bring a different slant, I think, to our conversation today because my focus is on the changes that we need to make to enable people, especially children, but everybody, to choose drinking water instead of the sugary drinks that are a leading risk factor for so many diet-related conditions, including type 2 diabetes, cardiovascular disease, obesity, and dental decay. I'm engaged in several research projects currently, including one on Navajo Nation, but I also try to work in that research to policy space, and then also the policy to policy implementation space. At NPI, another thing that I do is coordinate the National Drinking Water Alliance, which shares that mission of enabling folks to drink water instead of sugary beverages, with the common understanding that water is healthier than sugary drinks. We have a website and a listserv, so I invite you to explore the website. And if you're interested in being on a listserv of folks working on drinking water around the US, just let me know. Thanks, Wendy.
Wow, thank you all. We are really lucky to be able to coordinate and have everyone join us for this really important discussion. And as it was framed at the outset, you know, HWISE has really focused our work at the household level, but as we've seen in even the introductions today, we recognize that there are so many dynamics and pathways that affect health, well-being, and shape or prevent people from really achieving the human right to water. And building off of that idea, then the first question I have for everybody is, how should the human right to water inform the research agenda regarding water and sanitation insecurity in schools and healthcare facilities? And how has the human right to water informed your thinking about this? So really kind of focusing on that question of equity and justice more broadly as it ties to healthcare facilities and schools. So I'm going to hand it over to Ellis.
All right, Wendy, thanks for that question. You already started answering it by bringing in equity and sort of vulnerability. And for me, particularly, that's sort of the perspective from which I approach water, right? So in thinking about households or healthcare facilities and schools, you are actually, it's the same people moving from households to those spaces, except that those are temporary spaces, ideally, right? So we can think about vulnerability of certain populations and pretty much transfer all the very important questions about who has access, who does not have access, and then tie those to notions that have been very central to the human right to water, respect, capabilities, right? And so we think about healthcare facilities in a wide range, those in rural, those in urban, those that are small, those that are big, those that are private, those that are public, right? And I think that's what makes this a bit more complicated than households, right? And so that's the first part. The second part, and from my own research and how I think about this, is how human right to water brings in issues around obligation, right? Who is responsible for actually providing water in healthcare facilities? Those are easier questions for me to reflect on at the household level, because of course you live in your house and maybe your government is responsible. So here, the important questions that we need to be asking are how those kinds of obligations might change when you are thinking about, say, private schools, for example, or private healthcare facilities. So where does the jurisdiction of the state begin and where does it end? And how might that complicate notions around human rights the way we've come to understand them as sort of one big part of how I look at this. And finally, before I hand it over to the next panelist, I think when I think about human right to water here, it's important to look at the overlaps with other rights, right? So we are talking about healthcare centers, but that means we are talking about the right to health and well-being. If we are talking about schools, we are talking about the right to education, and these are all very interrelated. So as sort of the way we reflect on the human right to water, how might we make this interdependent? Where we are talking about human right to water, but we are really framing as a human right that is dependent on other rights, right to access to good education and right to sort of access to good health. If you are in a healthcare facility and you are pressed but cannot use a bathroom because you are worried that you might lose your position in line, as I've witnessed in Ghana many times, even when my dad, God bless his soul, when he was sick, is that there are a lot of challenges that lack of access brings, right? And so you pretty much transition from your household to go and experience similar things at a healthcare facility. And we can speak about that with girls and other vulnerable groups that I'm sure some of my co-panelists would mention.
Thank you, Ellis. Cassie, would you be able to talk about kind of how you see the human right to water? And it sounds, again, there's already this discussion around interdependencies of rights, how people within the schools, this is a complex question that actually goes beyond one set of questions, but rather around these other rights. Could you talk a little bit more about how you see the human right to water be part of a larger discussion on schools and healthcare facilities?
Sure. So, you know, where I'm coming from, I think, is looking at how a lot of interventions didn't have the kind of impact that we were expecting in the WASH world, that there wasn't the reduction in diarrheal incidences or stunting that we expected. And so I think that that does, as I mentioned in the introduction, speak to these kinds of extra household risk pathways that are, that children, or as Ellis mentioned, people who go to a health clinic, and to be helped, and then may inadvertently not be. And so then, just thinking of my own personal life, like my kids, right? They go to school, they always get germs at school. And I think COVID has shown the importance of hand hygiene. My kids, their hands got red because they were washing them so much, but for the first time, they didn't have the flu this year. So, just this is, I think, something that's a global kind of issue. But, I'll build on a paper you were the lead author on, actually. And what's really informed my thinking is, this idea that when we talk about securing a thing, so whether that's WASH security or water security, it's actually securing a set of social relations, right? And so that's really driven my thinking about this. And so, when it comes to, the provisioning of water in schools, for young women or individuals who menstruate to, be able to take care of their needs, if there's still larger issues and contexts that have to be addressed in order for any change. There was that one instance of a project where the young people were walking home from school and burying the sanitary pads, to presumably out of embarrassment. And so again, thinking also about, gendered use of space. And so there's no shortage of publications that talk about, this infrastructure is built presumably for equity, but then it's not equitable at the end of the day, because people make spaces meaningful in ways, that conform to like larger social structures and social issues. So again, I think, to me, and I don't obviously have the answer, but that's what's really informed my thinking, is when we talk about securing social relations, and as to build on what Ellis said, everything is so connected. And, like in the WASH world, right? Like food security is obviously related to water, and then solid waste, and, it goes out. So at what point, how do we put a box around it to, leverage really effective interventions?
Excellent. Yeah, the theme of interconnection, social relations have woven through what Ellis and Cassie have to say. Greg, would you like to talk a little bit more about how you envision the human right to water as it applies to schools and healthcare facilities, building on this conversation and these threads?
Sure, yeah, and I'll just be brief because I think Ellis and Cassie have been quite eloquent here. But to me, I think there's just a fundamental point that not all individuals can adapt to sort of the baseline conditions or to water insecurity equally. And you can, there's lots of frameworks for understanding this, including, for me at least, Amartya Sen's Commodities and Capabilities. And that really motivates, we're thinking about the human right to water, instead of what I see, most places doing, which is thinking of the human right to water as sort of a breadth of providing baseline conditions. And then frankly, out of household settings, schools, daycares, healthcare facilities are an afterthought, or sort of an appendix to the household setting in terms of provision, really motivating prioritization of those who are most vulnerable and at the most formative periods of life, which is exactly individuals who are in those facilities, for providing sort of a depth of access and service, and ability to use that service and understand that service in a way that we're not seeing right now. So I would say if we're thinking about a human right to water and we're thinking about individuals, not just, again, abstract households, which I'm guilty of, as many others are in this space, then prioritizing water security for these populations in these facilities where they spend a lot of their time is sort of, no one can argue with it. But I think from a policy and really societal perspective, we haven't quite made that shift yet.
That actually reminds me, and it's a great segue to Christina, because in her recent paper, and I'll put it in the chat in a second, I really was impressed by the structure around drinking water in the concept of the life course, right? So it wasn't location, it was the life course. And it really kind of was a moment of like realization that that is an analytical way of trying to address these interconnections that we've been talking about. Christina, would you talk a little bit more, not just on that, I don't want to sort of put you in a corner to talk about the life course, but tell us more about kind of this concept of the human right to water in the frame of schools and healthcare facilities.
Well, as you all know, as I mentioned, I focus my work in the US, and Wendy, thanks for mentioning our paper, but I wanted to say that your recent paper exposing the myths of household water insecurity in the global north really illuminates the fact that we do have a problem here in the US. It's not the same problem. It may not be as big a problem as other parts of the world, but even though we imagine that everyone in the US may have the human right to water, that's actually not the case. For example, out here in California, it's estimated that over 1 million folks are exposed to unsafe drinking water, and even more are currently in water debt thanks to the pandemic. But what we try to do, and I mean, this is really just so obvious, is to understand and direct our efforts to the least well-served in terms of water access. So whether that's an issue of geographic locations, socioeconomics, or other kinds of disparities. But a tool that I think can be used better in school and healthcare settings is sort of this concept of water in all policies. I think water has tended to be forgotten or taken for granted. And if we really make a conscious effort to think, where can water be in this policy and that policy, whether we're talking about vending machine policy in a hospital or childcare licensing policy in terms of providing water to children. So I think that is an avenue to better bring water security to these settings. But I also want to really highlight Ellis's comments on the shared nature of the responsibility for this. And that really does come up with schools in particular. Schools have so many different layers of oversight, and we have multiple agencies in the US that bring a piece of the drinking water or are responsible for a piece of the drinking water puzzle. So I think we need to figure out how to make that shared aspect actually work better than it does.
Excellent, thank you. Godfred, what are your thoughts on the human right to water as it relates to healthcare facilities and schools?
Sure, to add to what my co-panelists have just talked about, I think the human right to water may be tied to socioeconomic status, particularly when you consider the fact that individuals are nested within these schools and these healthcare facilities. It's these same individuals at the household level that patronize these services. But I want to make it more practical based on experiences and what might be happening in poor resource settings. You know, the experience of the lack of access to adequate, reliable, affordable, safe drinking water or, you know, clean water for use in these spaces is so critical. And if you are taking, let's say, Sub-Saharan Africa, for example, you have several of these schools lacking access to water, either on the campus or on the compound. And so some of the experiences that we do see at the household level translates to the schools. And if you look at the schools, you probably have the tertiary institutions, but at that level, the challenge is with administrators. And so when you're thinking of having access to water at that level, then research might want to focus on how these administrators may be looking at it. But at the primary and the junior high school level, there are several issues that are analogous to some of the experiences we've seen at the household level, where you have students having to walk long distances to collect water for use at the school, right? Because the school does not have a standpipe in terms of proximity, and so they have to walk some distances to get this water. And this increases the risk of contamination of the water if it is not covered. Again, you have issues of injury, and I'm sure we know a lot about it at the household level, but there have been reports of musculoskeletal injuries because younger children would have to carry gallons or buckets of water to school. Again, the schools may require the students to buy water, but this brings up the issue of affordability. If these people do not have access to the income, then like we find at the household level, they have to make a choice between buying food and buying water, which is also an issue that could be looked at. So you do see that, yes, access to water at the institutional level, particularly with the schools, maybe we can look at it from a human rights perspective, but economic disadvantages and the lack of adequate resources, either at the school or with the pupils, makes it sort of a privilege for the few. So it's only those with better or secured economic backgrounds that would be able to get access to this water. And I think research could look at that angle. But just to talk briefly on the sanitation part, okay, similarly, the issues have reiterated with regards to water. Similar issues could be talked about when it comes to access to sanitation. And maybe you might have read that some of these schools do not have sanitation facilities right on campus or on the compound. So students would have to walk 5-10 minutes to have access to these facilities. But that's at the school level, and it requires exploration. I think there's limited studies in this area. But let me briefly talk about the healthcare facilities, because based on this discussion, I took the pleasure to talk to my colleagues who are physicians and work at the hospitals in Ghana. And they gave me some of their experiences. But for now, let me talk about the fact that, one, you have issues of the lack of access impeding surgical operations, cleaning of theaters, cleaning of patients, the proper cleaning of healthcare facilities. And this increases the risk of exposure to diseases. One in particular that we know of is MRSA, that's methicillin-resistant Staphylococcus aureus, which is caused by bacteria. But this is easily transmitted if doctors or if nurses are not able to wash their hands properly. And this same bacteria is transmitted among patients if they are not washed well, and another patient sleeps on a bed that has been contaminated by the bacteria. And so you do find that even at the healthcare facility level, access to water is based on your socioeconomic status. Those who have the pleasure of attending private hospitals do not have challenges like that because there is access ready, So when it comes to, when we talk about human right to water, at these skills, or at the schools, or at the healthcare facility, I do think it is tied mostly to socioeconomic status, and that drives a lot of, the exposures that we see. And I feel like research, it is probably the new frontier when it comes to water research.
Well, I mean, that just leads to kind of the next question. And just to kind of synthesize some of these things, there are analogous dynamics within the household in healthcare facilities or schools. But what I've kind of pulled out of this initial part of our conversation is that the social relations, going back to what Cassie said, are different if we look at what the purpose of schools are and what healthcare facilities are. Those social relations are somewhat different and require new theory and new thinking. So we can draw on our experiences from our collective and individual work at the household level, but there seems to be, as Godfred just suggested, really important formative research and research gaps that we may need to focus on. And so my question for the panelists moving forward is based on sort of the comments made today and your own experience. What are like one or two key research gaps that you think we could advance as a research community, and especially in this area, and building on, again, the themes of interconnectedness, capabilities, as well as even methodologies. And I think we've talked a little bit about that as well. So Cassie, what are your thoughts? What are one or two things that you think we could advance as a research community in this area?
To me, and I've said this already, so I don't want to belabor the point, but I think this all really speaks to the methodological challenges involved in, trying to pinpoint risk. And I'm thinking, for example, a child in school might have great drinking water, safe drinking water, might have the sufficient water for hand hygiene. On the walk home from school, grabs a mango or, grabs a sachet of water and gets sick. And so how are you going to pinpoint the source at that point, just because people, everyone, you move around so much throughout your given day. So I think, that's one important area of future research. It's not that we don't recognize the importance of community level variables. I think they're just really difficult to measure and even harder than to turn into an implementation, right? So, and what I don't want to suggest is that we don't put water in schools, but just that also we have to recognize the totality of people's experiences as they go throughout the day. I had also thought to mention governance, but I know that that's something that Greg will speak more to, so I'll make that part brief. But, just in terms of putting in infrastructure in schools, in light of decentralization and, the movement and development to community ownership, who's responsible then for the maintenance of this infrastructure? So you might get a donor who, will build some taps, some water taps, or maybe build some latrines, but then does the responsibility then fall on the school to have to manage it or to clean it? So what does that then do for the ability to be effective educators in that regard? But, I think my recent work with engineers has really suggested, to me, just the blame that's associated with infrastructural provisioning. When you have older infrastructure that can't really handle the volume that it's being tasked with now, I've noticed that women are primarily blamed. So you see a lot of blame, for example, around, the pipes got clogged with pads or diapers, that it tends to blame women for this, the failure of infrastructure. And I think that just gets back again to this relational idea that, that this all exists within a context of specific social relations as well.
Thank you, Cassie. So Greg, what are your thoughts on kind of the research frontiers in this area? What kind of gaps can we fill or think about?
Yeah, I mean, one that Cassie mentioned and I talk about first is the governance problem a lot of times in this space, what I've actually seen is the sort of policy and effort is only reaches to the extent of problem identification and then perhaps, you know, the next step of here's a grant to fix the infrastructure. But then the question of who maintains, who pays for that infrastructure, you know, it's delegated to the school, or perhaps to the educational district. There's also you know, an inherent sort of lack of understanding in a lot of contexts, at least in the US, that you know, schools are responsible for their own plumbing, and that it's not the water system's responsibility. So there's sort of a gap in public administration there. But there's really just, it's a broader question, infrastructure generally, of who pays for the operations and maintenance, and also a political problem in that agencies and politicians love to fund infrastructure, but aren't so excited about things like you know, maintaining facilities that they don't get as much credit for. So there's a lot that needs to be done there, and I'm guessing others on this panel have some models for how things can be maintained. But there's an inherent sort of fragility to those arrangements, I think, compared to just solving the infrastructure problem. The other thing I briefly want to mention is just the issue, which I know Christina can talk to about, sort of effective access, and the issue of maybe even these facilities are providing water that's meets all the government standards of, you know, being safe, but it's still not clean, it's still not attractive. The facilities aren't maintained in a way that particularly, you know, children or you know, staff or teachers want to use, and sort of the path dependence that lack of use and lack of trust in water in those facilities leads to over the life course. So with that, yeah, I'll stop and let other panelists chime in.
Well, yeah, and it's a great segue to Christina. So what are your thoughts on this? I know your work has really tried to engage this question.
Well, Greg, you kind of took some of my words right out of my mouth, so thank you for that. You know, really, we were thinking about how do we define water insecurity, and I like the way my thoughts are really echo what Godfred has already spoken about in terms of what does water insecurity, or what does access to water really mean. So as Greg mentioned, we've developed this concept that we like to call effective access to water, but you might also think of it in terms of water access that meets what you might call the spirit of the law rather than the letter of the law. So the letter of the law might be plumbing code, where we need to have X number of water dispensers per number of people using the building here in the US. But what are those water dispensers like? And Greg has already mentioned this, but you know, it could even come down to, do they have adequate flow? I know we all know about water fountains that either squirt out or dribble out. And research shows, for example, that promoting water in addition to improving access is what actually, it's that pair that actually boosts consumption. So oh yeah, Wendy, thank you. You put it in the chat box already. We actually developed a tool that was designed to let citizen scientists document the quality of water access. You know, using a set of photographs that they would take according to our protocol that would assess these different parts. Of course, it can't assess actual water quality, which is too bad, the safety of the water, but it can assess the effectiveness of the access. And
there's an audio challenge. I don't know. Can you hear that, Christina?
No.
Can you hear that? Oh, okay. Does other people?
End?
It might be, yeah. I think
Okay,
so. All right. Try it again. I missed the last part. Could you talk about aqua one more time? Sorry.
Oh, I'm so sorry. Is that better now, Wendy? Okay. We developed a tool that would use a protocol for photographs that citizen scientists could, so-called citizen scientists. We piloted this using high school students around the country who took a specific packet of photos of water access in their school. And then these photographs can be coded according to our code book. Everything is in the toolkit on the website. But the idea is that it's really too hard it's too expensive to send researchers into the field. And when you do a big survey like Bridging the Gap or USDA on water access in schools, they'll see if there's a water fountain in the corner of the cafeteria, let's just say, and check the box, yes. But the goal is to actually document flow and cleanliness and so forth. But, you know, Wendy, I wanted to bring up another research gap quickly, and this was highlighted in the scientific report of the 2020 Dietary Guidelines Advisory Committee. Now, the dietary guidelines in the United States are important because they're the basis for so much of our nutrition policy, which includes in schools and childcare. And the scientific report noted that research needs include better information about water intake, including the quantity consumed, whether it's tap or bottled, whether it's filtered, carbonated, flavored. There's so much that we don't know about what people are really drinking. Then their next recommendation is that water intake needs to be reported as an eating occasion, so that we really know when people are drinking water and how much. And finally, they recognize the need for improved methods to quantify the frequency, amount, and timing of water intake. And they noted that the lack of this kind of reliable data on water intake prevented them from including water intake when they examined health outcomes. And they're not able to include water as a beverage in their food patterns, in USDA food patterns. So we need to think about how we're collecting information about water intake in order to build the evidence base more thoroughly.
Yeah, and that ties a lot with the work in some of our colleagues in HWISE who work in human biology and are really interested in questions of hydration and nutrition and trying to get at those methods require a lot of focus, attention, and research. So that's a really important area that I think this community is interested in linking into. Further, so Godfred, what are your thoughts on, and I know you've mentioned it a little bit earlier, but just a quick one or two research areas that we may need to, as a community, fill along these lines?
Okay, so thank you for the question. In thinking about it, I thought two things we could draw from what we've been doing already, but I just want to emphasize that context is important, right? Depending on where you're focusing on in terms of research, we might have experiences that are similar by countries in a particular region, but do differ by continent. And so it is important that when we're looking at research in these spaces, we need to be mindful of contextual differences. But one other key thing, I think it ties in so well with what Christina was talking about with regards to data. You know, what type of data are we seeking to examine when we explore these areas, whether water in schools or healthcare facilities? If the focus is to explore experiences, that could be done easily based on what we've been doing already. Once the incidence of COVID-19 decreases, and it's much easier to go to the field. However, there are other data sources. And so with artificial intelligence and the use of more advanced statistical techniques, we should be able to move from the use of just primary data that can be collected immediately, to data that is available. And so you might want to look at the volume of data that is now available to us. You have about 2.5 quintillion bytes of data that are available and that are collected each day. But the question is, what aspect of that data is made up of water? And that brings in the issue of the variety of data. There's a lot of data that's collected based on, you know, infrastructure in schools, based on what the amount that is being paid by the schools for these water utilities or for all kinds of utilities at the school, right? And so if we can get into that, identify that kind of data and work with, and it's not just in the schools, within healthcare facilities, we'll be able to, you know, sort of look at the trends, the decline of when there's a decrease in water assets and how it relates to some health outcomes, right? And I think lastly in this area, I just want to say that when it comes to data, we now have, you know, advanced methodological approaches that can be used in working these data that are available, and the need for us to identify data scientists with superior analytics to be able to draw out the information we need in making a case. But finally, I just want to say that in relation to that, we need to be able to continue with the participatory approaches that has been the strength of HWISE, that is drawing in disciplines that have previously not been part of this discussion. And so here I'm looking at health informatics or engineers who specialize in data to be able to draw on this data and make some arguments based on access, you know, affordability, or whatever measure we are looking at.
Excellent. Thank you so much, Godfred. And we'll go to Ellis on, again, this question of kind of research frontiers and gaps. As Ellis is doing this, please add questions to the chat, and we're going to go to a Q&A. We have a few minutes as well on that. So Ellis, take it away.
No, Wendy, thank you. I mean, a lot has been said, very interesting things. I think that when I look at, you know, there is such data gaps in this area, right? So that's the first problem we are confronted with. And I always ask, you know, what are the simplest questions? Can we focus on those first? And to me, I think that begins at experiences of vulnerable groups, right? So you're thinking about schools, there are disabled people in schools. If it's healthcare facilities, there are, you know, disabled, pregnant women, people who are diabetic with more water needs. So we need to really understand along that continuum, the experiences as they relate to water insecurity. One thing that strikes me as missing from this conversation is how water insecurity is actually affecting the delivery of education and care in those facilities, right? And so what is the tendency for a doctor to live in the middle of an operation to use a bathroom outside the facility? It may sound very simple, but it happens, right? And so we have to also think about the caregiving itself, you know, what are teachers using and what are doctors and nurses using within the same facility, so that the emphasis isn't so much on sort of patients and students without sort of also thinking about the other side of the equation. So that's sort of the first aspect that I see here. Number two, I always come back to governance, right, and institutions and what the gaps are. In Malawi, there's something I witnessed as I was doing interviews in my work, and that was that the water to a hospital was shut down because the hospital couldn't pay. So you can't even assume that hospitals have free water. So at that point, hospitals become like households, and we start talking about affordability and all these other challenges. But even more importantly, how those kinds of challenges intersect with other sectors, right? So in another instance, the water to the hospital is shut down because there was no electricity where the treatment plant was. So suddenly you see that water access is so tied to energy here, right? And so how are we bringing in all those connections into the fold, into the discussion? The final thing I would say that we really need to learn a lot about is how access dynamics at the household, co-determined, together with what happens in schools in particular, may reinforce each other into certain outcomes or particular outcomes. And that's a conversation I've had before with Justin, sort of related. So if you think about interventions, if you solve the household problem and you left the schools, how might that still compromise education, for example, right? And so we have so many linkages there, pathways that we really need to understand so that we don't tackle one and leave the other and just end up compromising or having interventions that do not even have the desired effect.
Yeah, I can tell you the connection between water, health facilities, and energy are not just tied in Malawi. As we know, in Texas, we had major healthcare disaster because for days the facilities they didn't prepare, they didn't have what they needed in terms of storage, and it was tied to energy. So this is not necessarily something that is determined by location. I think it's important to recognize that this broader conversation we're having does transcend this global north, global south divide, that these are ways in which we can think more broadly about these challenges. I really appreciate the way that Ellis was able to kind of synthesize all of this conversation into these 3 points, but particularly this question, and this goes back to my interest as well with households, is that co-determining question. And so it really leaves this community in terms of the research open to avenues around data, around governance, around even conceptualizing the relationships, both in terms of how water insecurity may compromise services, as Ellis mentioned, or the relationship between households and these facilities as well. So this is a really broad area. We're reaching kind of our hour. It was fantastic to hear everyone's comments. I haven't yet seen any questions in the chat, so I'll just leave that open for another minute or two. But I wanted just to kind of go back to the panel and thank you for your ideas and your thoughts, and see if there's anyone, and I'm going to sort of open it up to the panel of sort of final thoughts moving forward.
I'll toss out one final thought, Wendy. When we're speaking specifically about schools and hospitals, as we are, I want to bring up the, I think, important consideration, which is proactively offering water to people who are, for whatever reason, unable to ask for water or to think about their own thirst. That could be the elderly who don't recognize thirst very well. It could be little kids who are too little to ask for water. And so, you know, if we really want to make that final step from secure access to water to getting it into people's mouths, we need to think about not leaving out those folks who can't ask for it or access it on their own. Thanks.
Thank you, Christina. Other final thoughts? Any questions from the attendees, everyone else? I don't see any questions in here. Well, at that, we're at the hour, and again, I am just grateful for the time and effort that everyone on the panel has made today, and efforts to come and talk with us about this really important and I think understudied area of water insecurity. And my hope is that this conversation can continue, that this has created new connections and new insights across not only the panelists, but also everyone who's joined us today. Thank you, Christina. Thank you, Ellis. Thank you, Godfred, Cassie, and Greg. It's great to see all of you. Perhaps in the future, in future meaning short term, I mean, I think weeks or months now, we will reconnect and see kind of where this might be able to insert into not only our HWISE work, but also into the connections with other organizations such as the Drinking Water Alliance. I'm just been so impressed with Christina's leadership there and the work that they've done, and see this as an opportunity for us to advance these questions. So again, with that, I do want to thank everyone for joining us, and I look forward to seeing you next month. So next month we will be talking about how water insecurity